So when I'm mixing for the upper, we always mix it nice and thick like this, because we don't want it all coming out of the back of the tray and causing it to go down the patient's throat. So I always pop a little bit on my glove there as well, just so that I can check when it's set in. Just keep your lips nice and relaxed for me. We put it in up the front and then we slowly tip it back towards the back, and we're looking all the time to see the material where it starts to come out the back of the tray. Then we stop tipping and we just hold it until it sets. It's a cold day today, so I've mixed it with a little bit of warm water just so that it sets a little bit quicker. Nearly there now. When we're taking the tray out, we put it up by the tuberosities just to break the seal, because we don't want to make it difficult when we're taking it out. So we're popping the finger up just up to there, and then you just push it to the side, and then it will break the vacuum in the pallet, and then the tray will come out nice and easily. That's a good impression. It's a little bit more to one side, a little bit more one side than the other, but we've captured it fully. There's no pressure points. We haven't gone all the way down the throat and taken an impression of the esophagus. It's just the palate, which is always good, and that's perfect for the next stage, which will be a biting tray. Just a little tip when you're trying to get the level of the water right. I've got it, so I fill the water up to a good level like that, and then I put my finger in to a certain depth that it overflows, and I know exactly how far to put my finger in to get it to overflow, so that when I take my finger out, we got perfect level on the measuring pot. And again, when you're measuring, it's important how you do it. If you pack it down really hard, you're going to get more powder in than if you're just leveling it off. I always mix really quickly in the middle to get that first bit mixed up, and then the dry powder around the outside will help then form that bolus of material. And then I just sort of pat it in. Pop it in the tray like that, a little bit on my thumb. And the lower's a little bit different. Okay, open for me, just relax your lips. Poke your tongue out a little bit for me, that's it. So we don't usually have to worry about this going down the back of the throat with the lowers, because it just comes out under the tongue and out into those sulcuses. Again, when I'm removing it, I'll just put in my finger down there. So when it's in the mouth, I'll just put my finger down here under this little bit and pulling it up. When you're getting the air in there, it flows in, and then you can just wiggle it out. And again, we've got a really nice impression there. It's nice and thick around here, which is good, because if it's too thin, it moves when it's being cast up. You get the distortion. This is why you should never use Alginate to make a denture, because of the distortion of the weight of the plaster, and also when the plaster's set in, it might get moved a little bit, and it will push in areas and distort. Right, we're just going to take the shade. Okay, so just want to see your bottom teeth there. The C2. Yeah, so we're all done for today.
Okay.
All right, so we've done the first impressions. They're really good, really happy with them. And then we're doing, it's a full upper, so we're doing injection moulded. Yeah, so they'll be a week apart for each of the appointments.
Thanks, Simon, your style.
There we go, all done for today. That was a really good impression that we got there. I'm happy with those. We got all the full extensions of flanges and things like that. And we captured all the detail we need for the next appointment, which will obviously be bites and special trays. Now, we did do the shade today. I always like to do the shade at this appointment because it gives the lab plenty of time to order the teeth in. If they haven't got them in stock, they might need to order them in. If they do need to order them in, the suppliers might not even have them in stock, so there could be a little bit of a delay for a few days, which is then not going to give them enough time to get the try-in done if you're taking the shade at the next appointment, which will be the bites and trays. The other thing is, when you're taking the shade, sometimes it can be a little bit tricky to get the shade from the patient's teeth, especially if all their teeth are different colours. So you can either go in between those shades, so rather than pick the darkest tooth and go for that, or pick the lightest tooth and go for that, try and get somewhere in between, because if you just go for the lightest teeth, sometimes all the lighter teeth on the opposing arch sometimes looks a little bit too much. I know a lot of people will put on darker canines, which is quite natural. I find that I don't have to, because the teeth that I use, the Enigma Life, I find that those teeth are slightly darker anyway, just because they're bigger teeth. So they're not actually darker when you look at them on the slide. However, because they're a bigger, denser tooth, they're letting less light through, so the shadows will make them look a little bit darker in the mouth anyway, and I think that's usually enough. And also, the thing to consider is if a patient's got a small mouth and they're having small teeth, those teeth, the smaller they are, the lighter they will look. So if you've got a big person with a big mouth and you take the shade, you need to allow for that compensation of a bigger tooth. It will have more material, it's going to let less light through, therefore it will look darker. So just to recap, the bigger the tooth, the darker it's going to look in the mouth, so you might want to go for a slightly lighter shade, or vice versa. If it's a small tooth, it's going to look lighter in the mouth, so you might want to go a little bit darker. Hope you found the video useful. Don't forget to like and subscribe, and we will see you in the next one. Cheers guys, bye bye.